let's contour his body amazingly. Give him a nice six-pack, give him a nice chest. Libo goes over and above. Look at the beautiful fat coming out, man. And I tell my patients, if he drinks all that's coming out into that thing, if he drinks it, I give him his money back. You know, fear factor, gynecomastia. So he's got to eat the gland, and he's got to drink the soup. And I'll give him, I refund his money. But he's got to do it on camera.
You have spices to go with that, right?
What?
Spice it up a little bit?
Yeah, you put a little hot sauce on it.
Oh, nice.
You know, drink a little milk.
I actually saw a store in the outlets in Deer Park.
Yeah.
It's a store just for hot sauces and like spices and stuff.
Oh, yeah.
I probably got some hot stuff in there.
Well, what's that factor? The Scoville factor? The Scoville? Everything's off to the jalapeno. There's that. What's the hottest one? The ghost pepper.
The ghost pepper, right?
The ghost pepper.
You guys can see it coming out.
It's the Scoville thing, whatever it's called. You doing all right?
Perfect.
So guys, this is the high def lipo.
So now I'm using my smart hand. I'm etching. Again, with guys, do I need to repeat myself? It's all about the lines and then the shadows. With guys, so I create these lines. Okay, the lats, the pecs, semilunaris, midline linea alba, and then I create shadows. Look at this little thing. It's like nothing there. It's a little peanut.
Moving it down even more.
What about a sip, doc? How much money back for a sip?
No.
Nah, it has all or nothing.
Don't fuck with me, man. Don't fuck with me.
Oh, it's all or nothing,
It's all or
man.
nothing. A sip, please. You gotta guzzle it down, man.
Plug your nose, head back, and
Yeah.
Going up quick.
Yeah.
yeah, we're making
Nice.
moves.
This is orange. Orange Julius going on here, man.
I don't know. What's?
You ever had an orange Julius?
Oh, yeah. How about you guys? Ever had the Julius? Orange
Not after hearing that.
I don't know what's an orange Julius.
It's like an orange cream milkshake type.
Yeah.
Um,
yeah.
Orange cream smoothie.
They had them in the malls back when.
back in the day, there were a lot of them.
Never had.
There's the Roy Rogers, right? The Roy Rogers in the.
What's the Red Roger?
Isn't that the? It's like Shirley Temple, but instead of
Oh yeah.
it's grenadine with Coke, basically.
I got a question for you. You know, the Arby's. Whoever really ate at an Arby's?
I did like once or twice.
I've
Yeah,
never.
like everybody says Arby's this, but you know, you go past an Arby's, they're always empty.
I didn't like
Yeah.
It's like Long John Silver. Remember Long John Silver? Nobody ever in there.
That's how I feel about White Castle.
White Castle?
I feel like no one goes to White Castle.
But everybody talks about it.
A lot of takeout, you know.
Arby's is trash, someone says. So there you go. Or people agree with us.
What about White Castle?
Well, it's that movie, the
Harold and Kumar.
Harold and Kumar, right?
Looking good, my friend. How you doing?
Perfect.
Oh, beautiful.
Kind of tickles.
It kind of tickles. So for those asking, does it hurt?
No pain.
No pain. Yeah, there you go.
This was on the channel.
Yeah. So those that are asking, is the patient awake, and do we do this under general? Blah blah blah. All that. We do it under local. Patient is awake.
Dr. Lebowitz expert local technique. Sure.
Burger and cola graveyard. Please, doc, don't give up the fight. Nah. Gynecomastia is not going to win in this battle.
Yeah.
You can put this right on there by your side and not
Well, when it comes to anesthesia, any gynecomastia surgery is going to have anesthesia in it. It just depends on what type you get.
So now I'm scoopity doopy, getting underneath this gland, and you'll see in a little bit what his glands actually are. They're little nothings. When I tell you, man, everybody, get these guys 260 pounds. No, doc, I just want the glands removed. They go, oh yeah, right. Yeah. I'm smarter than that. You know, I'm 65, man, almost. A month or two shy of that, man. I've been around. I've done everything, seen everything, corrected everything. If I tell you, you need it, man. You know, don't argue with me. You can argue with me, but go to someplace else.
Is it the same medicine the dentist used? Yeah, it's very similar. Yeah,
But a lot more.
it's just a lot more that he pumps into you, but it's the same. It's local. So this guy's from his chest all the way down to his belly button is numb.
And Dr. Lebowitz has a special recipe too.
Yeah, man.
Yeah, man, he's got a special stuff he uses.
Special sauce.
Yeah.
Lettuce, cheese, pickled onions.
Secret sauce, man.
Yeah, and a sesame seed bun.
Yeah,
Onions, pickles?
pickles, onions.
Nah, it's onions, pickles.
Don't try this at home, okay?
Yeah.
Oh, somebody said, Doc, tell me everything. I want to do it at home. Tell me everything.
Novocaine is like the old word.
Yeah, xylitane,
So
novocaine,
what do they call it now?
same thing. I mean, sometimes there's newer ones like Marcaine that, you know,
I think that's the word I was thinking.
yeah, Marcaine is slower acting but longer lasting. But also I find Marcaine causes bleeding.
Are there less complications with local?
Yeah.
With doc, there's less complications. That's
Yeah.
right.
I mean, look what I'm doing. So if I'm, you know, doing something bad, you know, to his muscle and stuff, he's gonna feel it. He's gonna say, Doc, I feel it. I'm gonna say, oh shit. If he's asleep, you know, there's no feedback.
Exactly. Are you comfortable, my man?
Yeah, that's a good point.
There's no feedback.
Patient
You know,
said
you
he's
can-
very comfortable.
You can puncture a lung and you won't know it until you do it. With him, if I hit his rib, he's gonna say, Doc, I feel that, because I didn't numb up his rib. And he comes back to me, says, Doc, I feel it a bit. And I go, okay, back out. I like it, man. I'm too old to change.
Yeah. Also, you know, you're gonna wake up, you're gonna be nauseous, you're gonna, you know,
Can't pee.
yeah, it's a whole process that happens, you know, when you get general. With this patient and all of our patients, when they're done, they can go get a burger across
Yeah.
the street 20 minutes after surgery.
Go get a slice.
Yeah, recovery time.
Go get a
downtime
slice,
is very
man.
Minimal downtime.
You know?
Yeah. So it's not only the glands and the chest, but also the abs as well. Yeah, with our Beyond Gynecomastia, you know, what Doc said, if you weigh like 160, 170, you know, you're 19, 18, then you may be a candidate for just the gland. But if you're, you know, 200 pounds, over 200, you know, and
Or you just want to look fire,
yeah.
you know? Say you want to impress a girl or a guy.
How much do you weigh?
No judgment here.
There you go.
Well, 176.
Yeah, so this patient weighs 176. He's in his 20s, weighs 176, 5'8". You know, you wouldn't consider him to look fat or anything. You know, he normal, you know, looking.
Now. Wait a couple years, man.
But we're doing lipo on him as well. So, you know, really, it's rare for a lot of our patients do get the lipo as well, just because it makes you look fire. But
And it's not that much more money. You know, it's a big difference for a little bit more money.
yeah, you're 265, 100%. We can say already that you would need
Well, what do you think?
6'4", 265.
Yeah, what do you think?
Yeah, if you have some, you know, fat that's even on your chest as well and around your belly, then you're gonna need what this patient is getting.
Perfect.
I mean, you're
Removing the love handle.
yeah. I mean, your BMI has to be pretty low for just to be just to be gland.
Oh, that felt so good. All right.
I was curious what was gonna happen.
Oh, that felt
I
so
don't want
good,
to take a
man.
moment.
That was huge.
There you go.
That's a release, man. Oh, girls in the room.
Oh, yeah, there you go.
Kathy's one of the boys.
Oh, yeah. Today.
Yeah, if you need a tummy
I
tuck,
wish he gets moody.
Oh.
Doc doesn't do tummy tucks, but he has people that he knows that does it.
I
So
should start with Cuomo and say that I'm working in a hostile environment.
No, you're not. You don't have to work. We don't say anything directed at you. We don't say anything
Sexual
directed at you.
innuendos.
We're, this
Anything
is
for money,
this
right?
is guys, man. This is guy.
Can I say we love you, Kathy? You have to ask that.
we love Kathy.
We love guys.
Our patients love Kathy.
You just have to ask now.
I'm 285 in, be working out. Yeah, I mean that's
Look where I'm
280.
going, man.
Yeah.
Look where I'm going. With me, you know, I'm in it to win it. You know? I want him to say, damn, Lebo, what did you do? He went way down here. Yeah, felt like it.
You okay, my man?
Yeah.
Cool.
It's his birthday present.
Listen, he's got a girlfriend. You know, maybe a baby in 9 months from now. Who
A
knows?
little longer.
Yeah, just
I don't know. She may not be able to resist.
You're going to give him a slip and slide, man. Slip and slide. Boom, boom.
If you're 280 and 5'8", yeah, that's you're gonna have to drop down to like, you know. if
Oh,
you could-
280 and 5'8"? I don't know what that BMI is. Over 30. Look it up.
Yeah, definitely drop down. If you could drop down to 230, 240. See what happens, you know? It's a journey. What is the cause of gyno? Just bad luck of the draw.
Yeah, look at the drum, man.
Yeah, it's bad luck, but also it's the food we eat, and you know, everything that's in our food has those chemicals and
oh, good.
Yeah.
and stuff like that. So it's what we eat as well.
Anything at all, okay? I'm a man up about anything.
It's a nature versus nurture question, right?
Cool.
Look what I'm doing. Where? What is this?
Look how low he's going,
Yeah,
guys.
Like big brother.
I'm gonna suck up
father
a
hand.
ball
Okay.
one
What's
soon.
that? Big brother, father hand.
I may suck up a ball. I'm going so low, man.
Oh no, man.
Yeah.
Well, he said he's got 3, so he
He's
can
got
afford
3.
he can afford to lose one.
He's Greek. What's that thing? Trice. What's 3 balls?
I'm actually not sure.
Trace. It's in my big fat Greek waiting. Trace Agriros.
Yeah. I mean, why do you have to drop down? Some people need the motivation. It's because when you weigh, if you over 250, 260, 270, you know, it can cause a lot of issues and it's a very difficult procedure for the patient and for the doc, you know. So the lighter you weigh, the less you weigh when you get on the table, the better it'll be. So that's why it's definitely recommended to lose as much as you can before you get on the table.
Try to make it a great experience for you, man.
Yeah.
Appreciate it. Yeah. Without a doubt.
But again, you know, if you do weigh 260, 270, and you know you video call with Doc and he takes you on as a patient, you should feel confident that he'll do a good job, because he won't take you on if he believes he can't do the job right.
Beautiful.
Yeah, I won't take you on. If I take you on, man, I bought you.
Yeah.
I bought you, I owe you. You own me.
Yeah, he took medication that was prone to giving men gyno. Yeah, people take. Yes, that's also true. Yeah, I mean, the more you weigh, the more money it's going to cost. You know, someone who's 170, it's going to cost different than someone who weighs 250.
Yeah, it's like a painter. How many rooms?
You know, painting one room is going to cost less than painting 2 rooms.
But that's what they tell me.
Someone getting just the chest and upper abdomen done is going to cost less than going the full belly all the way down. You know, just it's the nature of the
I'm
biz.
going to 600. Cool. Oh, say big.
You guys can see already, looking good.
Good.
Yeah.
Yeah, relax, John, my friend. Try to be comfortable, my man. Doing
What are you
nicely.
doing right now?
I'm doing the horizontal inscriptions of the rectus abdominal muscle. Baby,
Oh yeah.
what do you think? Levos don't mess around.
Sculpting, body sculpting, man. Beautiful.
And I guarantee my work, baby. Used to see how many doctors, how many patients contact me weeks later from another doctor. Oh, I didn't get what I thought I would get. Well, the fuck? Go back to that doctor, bother him. Or come to me. There's a saying, pay cheap, pay twice.
There you go. Nice. Very nice.
Yeah, reach out to us on Instagram. You can email us, call us. We have our contact information all over the place, so definitely recommend a consultation. Does stretch marks limit the skin contraction?
Yeah, it shows that you've had damage. It shows you've had damage.
That's just 6, man. That's just 600.
Stretch marks means you had damage. Stretch marks basically is tear of the underskin, of the dermis, without tear of the epidermis. Look where I'm going, man.
You had some 600
Yeah.
if you wanted.
I'm grabbing his pee-pee as we do this, man.
Oh,
We're gonna put some fat in his pee-pee.
no way.
Yeah, make it look like a kielbasa.
No, baby.
They're gonna call him a tripod.
A lean-to.
A lean-to.
It's gonna be like a Slim Jim, you know, Slim Jim into a kielbasa.
That's right.
Is it possible for that tool to poke out the other side? No.
Poke out where?
Just out through.
Nah,
No.
I know what I'm doing.
No. You guys see his left hand, that's a smart hand. So you could see he's feeling where the end of that the probe is.
Yeah, his eyes
So.
are on those fingertips.
You can see where he's at right now, and that's
Yeah, I just
That's
actually
important.
hit his bone right there. Just a little bit. Yep, I just hit his bone.
No, let him have it, dude.
You gonna do the grip handle or?
No, I don't think I need it. My 6. Oh, shit, okay, let's go over here.
so yeah. There is a difference between J plasma and Vaser. So
Tell me the leader.
Okay.
And we'll-
I'll explain that question in a second. Doc, what's the difference between J plasma and Vaser? Give us a.
Well, Vaser is before J plasma. You melt the fat, you melt the gland in preparation for LipoSculpting. J plasma is after everything. liposuction is done, glands are out, and that's helium gas. So Vaser is ultrasound, just basically sonogram, ultrasound technology to, break up, emulsify the fat in the gland. J-plasma is helium gas with a fire, a radio frequency fire stick at the end, and that helps to tighten up the skin.
And this is J-plasma right here, guys. So we're actually not doing it today. So
We're not doing it.
this is Renuvion J-plasma. We're not doing this today just because the skin is tight enough.
Remember, I custom tailor all of my patients. I don't overcharge them.
So just to explain, is J-plasma results are better than Vaser? They're two different things.
Two different things.
Two totally different things. Don't get them confused with one or the other. Vaser and J-plasma do totally different things. So, there's not like a decision to choose between the two. Vaser breaks down the fat. So that's why what you see the tube that Clarence is holding right there, it makes the fat easy to go through. The Vaser breaks down the fat. It's like having a slushy and trying to suck the slushy through a tube, through a straw. It's tough. But with the Vaser, it'll break it down. Now the J-plasma tightens the skin. So two totally different parts of the procedure. This gentleman had Vaser done, but is not having J-plasma.
He doesn't need it. And I want to save him some moolah.
Makes you look appropriately perfect.
So obviously it depends on what job you do, when it comes to taking off work. We've had police officers who have to wear vests, take about 2 or 3 days off. So normally it takes about 2-3 days, but if you have to lift heavy boxes and stuff and that's part of your job, then you have to wait 2 weeks to do the heavy lifting.
We'll hit a liter. We'll switch it over.
If you're a truck driver, it's not going to be as big of a deal. But we have our patients stay 2 days post surgery for follow-ups.
You said you hit the other way, brother? Good man.
Yeah. So I see people 24 and 48 hours post-op. That's my MO. You want to stay a little longer? You want to stay a little longer? This guy's relatively local, so I'll see him over the weekend. I work Saturday and Sunday. And then if he wants to come back like in a week, 2 weeks on a weekend, do some of his job, for 1 or 2 times, whatever he wants, I will do. I'm at your beckon. I'm at your beck and calling. I'm your bitch, baby. I'm your bitch. I don't mind saying that. Yep. You right? Good. A little tingle.
Does nipple lift scar, doesn't get fade or remains forever?
It remains forever.
It remains. A nipple lift, you're gonna...
I don't love doing them unless it's something that is mandatory because of weight loss or location of the nipple. Whoa, okay. Oh, hold that one close. All right, give it a break. All right, we're getting a bigger boat.
What was inside of him? That's the cannula.
We got 2.5 liters out of you already.
So this right here is what we use to suck out the fat.
Well, we put in 3, a little bit more, We got more than half.
So now we're just
I'm gonna
flipping
be
things
done.
over.
I may make a little hole in your belly button. Why not?
Nice deep breath,
Maybe a
bro.
little. Not gonna make a.
What is he putting inside of his body? I'm confused with your question, but this is the cannula that we put in. That's that probe that we put in to suck out the fat. That's the tool we use.
So I'm making a little hole in his belly button to kind of give him some six pack. I think he'll deserve it.
Yeah, man, it looks nice. Looking real good.
All right, so I need another 100 and some odd from this side. And I think I know where to get it from. Over here. Made a little hole in the belly button. But it's inside, so he's not going to see it. So when he wears his banana hammock on Jones Beach this summer.
That's the local anesthesia. There's no blood because it's the local that kind of restricts the blood vessels. That's why if you try this at home and you don't do local, if you do this, you're gonna bleed out.
Oh, somebody contacted me. He tried to do it like a year ago after a tequila drunk. So he says, Doc, I just want to warn you, I have a scar by my left nipple. Because I was a couple years ago, I was drunk on tequila. I tried to do it myself. I said, oh shit.
Yeah, no, don't try this at home, guys. I mean, you guys may say, oh, I'm taking notes, I'm going to try this at home. But there's a lot of stuff we have the patients take beforehand, medicine, that we have the patients take, and it helps.
They need a smart hand to go along with it.
Yeah.
Definitely with that.
Yeah, we're going to give him a six-pack.
Yeah.
We are going to give him a six-pack.
Perfect, man. Beautiful.
We're going to give him a six pack. We're going to give him serratus.
His serratus was nice beforehand, but we're going to really
It's gonna pop.
pop.
Nice. Very nice.
You all right?
Perfect.
Having fun?
Lots of fun.
Got a little gland there now. Look at that. It's like nothing.
Give us a thumbs up. There you go.
Double thumbs up, man.
A double thumbs up. He is awake.
So that's from here. Midline.
You guys are going to see it go over in a sec. Again, this is under local anesthesia, so that's why he's not hurting. You try this at home, you'll be hurting.
We're just joking about trying it at home. Right?
Yeah.
Yeah, right.
Not be careful.
That's a good question. The fat won't come back. You'll get fat elsewhere. You know, your neck, your thighs. You know, you won't get fat in this area because Doc goes for that deep fat. You know. It varies per patient, guys.
How much?
It varies per patient.
How much? You ask the hooker how much. Roll down the window. Get on Lower East Side. How much?
And even then, they have their they have their prices.
They got their prices, right? He knows.
He knows.
He knows. Look at that.
You guys can see it form right there, that midline. And remember, this guy's he's swollen a little bit, so
He's swole.
Yeah, he's swole.
He's swole.
You know, we gave him how many liters? 4 liters.
36.
Yeah, 36. So, you know, he's gonna be swollen for a bit, but you guys can already see the 6-pack form. Have you ever done surgery on a famous person before?
I'm not telling.
He's
Famous.
This guy's famous. All of our patients are famous, you know?
Yeah.
We treat them like they're famous.
He's famous. Everybody's famous. Everybody's an A-lister, man.
Everybody gets the same great care, man.
And everybody gets the same treatment. That's right, Clarence.
Same great care. What we do.
What's that song? It don't matter if you're black or white. What's that song?
Oh man, I don't
You don't know? You know what I'm talking about, right?
Yeah.
What?
Michael Jackson.
Yeah.
Michael Jackson's song.
Yeah. It doesn't matter
No,
what you look like, how old you are.
Or the Backstreet Boys. I don't care who
You are where
what
you're
you've
from.
been,
Yeah, that's true.
as long as you love me. Right, Clarence? As long as you love me.
There you go, man. That's it. You good, brother.
Hope you guys are liking the video. Some good content here. Hope we're answering your questions.
Look at this, Serratus, man. I mean, really. Lipo gives you everything. Working 9 to 5, and the way to make a living. Oh yeah, baby.
Man, you're gonna be too sexy for your shirt.
Sexy, man.
Too sexy for my
Not
shirt.
right, that bigger braid can't never.
Mama's teacher's gonna say, "My boy, are you ripped?" What's your mama's name?
My actual mom?
Yeah.
Sandra.
What's that?
Sandra.
Sandra? Oh,
We got-
Sandy.
I gotta get the playlist, man.
You see final results, 6 months. But you see the results immediately. But six full months for everything to be, 100%. How about anesthesia? LA, GA? I'm not sure.
Yeah.
Oh, general or local?
Anesthesia.
Yeah, this is.
LMA.
LMA.
No, we don't do LMA.
No, that's a tube in your mouth.
Yeah, no, we don't do.
It's like a bladder in your mouth.
I think he meant LA as in local anesthesia or GA as in general.
Yeah.
We do local.
Local only. That's my claim to fame.
Local only. If the patient is anxious before surgery, is anything we can give him to relax? What do we give him? Yeah, we give Valium.
Some benzodiazepines.
Yep.
Relax them.
We got 2 great nurses with us.
Lots of TLC, man.
Yep. And we also got Pronox. That helps relax the patient.
Right? Yep.
Just got there, and the other way, my friend. Beautiful, man. You got you, brother. Up here in the zone, my friend.
National pride. Turn on the side a little bit here.
Facing that way?
Yeah, facing that way. Yeah, watch out for that one towel. Yeah. Go for it. All the way.
You want to reach your arm over your face?
You have to.
Oh, it's right.
Yeah.
Yeah, we want to
your
your
shoulder
side like
too.
a log roll.
And scoot your shoulder back to me, okay? Scoot your shoulder back.
Sprinkles.
Look at this, guys. All under local benefit right here.
Give him your wings, man. Your wings are popping
Give him
out.
your wings.
That's it.
Red Bull.
Oh, yeah.
You want me a soda?
Let's share it 3 ways, bitch. You started it.
That's the sweetest year for the week.
It'll look like Michael Phelps.
Oh, baby, yeah. Women's body, man.
Kind of weird that their bodies, they're always hunched over.
Yeah.
Yes, this is under local.
Posture. The breaststroke, like they're always hunched.
What about sleeping posture? I mean, right after surgery, you're going to be draining a little bit. So we give you some pads and stuff to make sure that it drains out properly.
At least the first day.
Yeah. Yeah.
The other side.
Same thing on the other side.
The other side. Break on through to the other side.
Not with Doc. With Doc, it's only one option.
Hey, just bend your elbow, my man. Bend your elbow down to the bed. Perfect. Yeah. Good man. You're a great patient, dude. Seriously.
You just saying that?
Yeah, of course.
We wouldn't say it if it wasn't true.
There you go,
We
man.
wouldn't say anything.
There you go. But all patients are great, though. But you know what? You're exceptional, man.
Yeah.
You're doing it. You're definitely doing it for yourself.
Can you relax the left arm?
Yeah, man. Yeah. Even though we got to turn into a pretzel now, right?
Yeah.
We need yoga position.
That's the beauty of local, right?
Yep.
Oh, man. Very cool. Told you we were gonna have fun, right? Exactly. Nice. Nice. Good man. Almost at 5 minutes.
All right, guys. So we're wrapping this up.
We take out the glands in a few minutes.
Yep. And
Then we're gonna be done.
then we'll be done. Yeah. And then we got a second patient later on. So stay tuned. We're just gonna do the gland removal later.
Unilateral.
Unilateral. Yeah. So that's a unique case. And we'll jump on YouTube Live again for that. So stay tuned. We'll probably do that in
Got it.
about 2 hours. Roughly around 2 hours. So just stay tight. Hope you guys like the video. If you guys have any questions, again, you can message Doc on Instagram. He answers everything right away. And I hope you guys liked the video.